Scientists are developing a new therapy for a cancer patient. In this therapy, they extracted T cell from the patient with malignancy and modified that T cell genetically to express chimeric antigen receptor against the protein overexpressed by the malignancy with ability to stimulate the T cell. After this modification, scientists infuse back this modified T cell into the patient. Which of the following additional medication will most likely prevent the death of the patient due to chimeric antigen receptor T cell therapy? And the options are monoclonal antibody against CD20, anti-tumor antibiotic, anti-IL-6 monoclonal antibody, and colony stimulating factor. These are the options. You can pause the video and answer the question. If you already answered the question, let's discuss the question. Here they are asking about the chimeric antigen receptor T cell therapy. And in this therapy, generally scientists take out the T cell from the human body in the lab, they grow the T cell and they modify the T cell genetically by adding chimeric antigen receptor gene in the genetic structure of the T cell. This will express the chimeric antigen receptor on the surface of the T cell. This chimeric antigen receptor which will bind with the tumor cell which already overexpress the chimeric antigen, and this is the chimeric antigen which is overexpressed by the T cell, and this is the chimeric antigen receptor which was enhanced to express in the T cell by genetically modifying this T cell. Here we can see that chimeric receptor is interaction with the chimeric antigen. But in order to stimulate the T cell, there are other stimulatory signal is also necessary like CD3 and CD8 interaction, which is also necessary. But we are focusing only on the chimeric antigen receptor activation, and this interaction will lead to stimulatory action in the T cell, and when T cell stimulate, it release the lots of cytokine in the plasma, and this cytokine cause life-threatening cytokine storm, and this storm will lead to the death of the patient. So if in order to prevent this death, we need antibody against this cytokine, and that's why our answer is to prevent the death of the patient due to chimeric receptor therapy, we need to give anti-interleukin 6 monoclonal antibody. So our answer is C, anti-interleukin 6 monoclonal antibody. I hope you understand this concept. The next concept we need to understand is, what if we make chimeric antigen receptor against something else like CD20? Suppose this is a B cell instead of the tumor cell. B cell express CD20 on its surface, and if we made chimeric antigen receptor against CD20, it will destroy the B cell, and this therapy will works against the B cell lymphoma. And in the body, we can find hypogammaglobulinemia in that patient. Let's discuss the other option given in the question. The monoclonal antibody against CD20, which will bind to the B cell surface and try to kill the B cell, which works in the B cell lymphoma. Second is an anti-tumor antibiotic, which bind to the tumor cell directly and try to kill that cell. And colony stimulating factor, which activate the bone marrow and stimulate the lymphocyte production, which works in the lymphopenia patient. I hope you understand this question. Thank you.